their risk and also understand their responsibility in terms of protecting themselves as well as their partners from HIV infection. So in our approach, we put these men in subpopulations depending on their level of risk. So would have men who, for instance, are saying, we have got multiple partners. We need support in changing that behavior. We need support in being encouraged to use condoms. So that helps in terms of addressing their prevention needs holistically, including their sexual partners. So we find that we are able to reach their sexual partners with PrEP and ensure that they are protected from HIV infection. We are also, through them, are able to reach their partners to promote female condom, as an example. We are also able to use their partners to do index testing. We also encourage and promote self-testing because we realize that, it is already mentioned, men do not like going to the hospital. In fact, they reach the hospital on their deathbed. So what we also learned is that men are willing to open up about their health issues, especially when discussions are led by male service providers. So if you are a woman, they tend to be more closed up. But if you are a man, they are free to talk about their issues men to men. So that's a strategy that I think is important for us to recognize so that we are able to make men comfortable to express their needs. There is also an expressed need for mental health services. Men are dealing with a lot of issues and they don't have the platform and the opportunity to express themselves like women would do. We know that you meet a woman, within 2 minutes, you already know everything about their lives. But men are not like that. So we have to be deliberate and intentional in ensuring that men have spaces where they can talk about those issues, but most importantly, ensure that they have access to mental health services. Men also express that they do experience gender-based violence. Even more often than not, our target is women, but they do also experience gender-based violence. And the greatest challenge is that they are unable to report these issues because when they do, they are seen not to be men enough. So they tend to retreat and be in their small corners where they feel that there is no help coming their way. So it is important that we also prioritize addressing gender-based violence among men, or men as victims of gender-based